Well, hello everybody, and welcome to the latest in our series of webinars. Today we have something a little bit different, not just politicians or diplomats. We have someone on the cutting edge of the problems facing the Middle East region. It's my very, very great pleasure to introduce Shiri Ben David. We last met in a restaurant in Jerusalem when we were discussing the prospects of there being a ceasefire and the consequences of the conflict in Gaza. So, as someone who is actually on the front line of the conflict, it seems a very, very important time to be talking to her. She's a rehabilitation psychologist and chief psychologist at the Hadassah Medical Center. She's had a key role there for 20 years. Apart from the time she takes out being a mother of four, she has a BA, an MA, and a PhD from Bar-Ilan University. She leads 130 psychologists across several campuses, and she is the senior lecturer at the Department of Psychology at the Hebrew University of Jerusalem. So we are more than honored that she's taking the time to talk to us today. Shiri, it's lovely to see you again. And it's a great pleasure to have you on our webinar series. It brings, I think, a human aspect to the policy discussions that we often have. And I think it gives us a chance to explore the consequences of where there are failures of policy or where situations require policymakers to think perhaps a little bit more left field when it comes to the human impact of their decision making. So welcome. And maybe I can begin by getting you to talk to those who are viewing this webinar about why you chose to be a psychologist and what's the importance of psychology in the wider clinical environment, just so that I think we can set the ground rules, if you like, for our discussion.
Yes, of course. Well, thank you for inviting me. It's an honor to be here and great to meet you again, Sir Liam. I think since I was 15 and I abandoned the dream of being a veterinarian, I knew I would be a rehabilitation psychologist because I believe that exploring the inner life, mental health, is something that is one of the most meaningful things that a person can do in life, and understanding one's inner motivations and one's own patterns that actually rule the way that we take decisions and the way that we cope with our reality is something that I admire. And in the past 22 years, I've been a rehabilitation psychologist at Hadassah Hospital and other organizations. And I see the way that psychological treatment, psychotherapy, enables people to understand themselves better, to cope with the challenges in their lives. It can be a very short-term psychotherapy dealing with specific problems people are facing. It can be long-term psychotherapy dealing with major issues that are accompanying people's lives. But understanding the way we behave and the way we understand the reality and to change the way we do it in order to improve our well-being and our mental life is a huge challenge and a very satisfying one.
It's when we met, of course, we were seeing casualties coming in from Gaza, that Israelis, Palestinians, Jews, Arabs, all coming in. And of course, this has had a huge impact, not just on patients, but on professionals. And by that, I mean professionals in the armed forces and professionals who are the medical staff dealing with these. From your own experience, from your own perspective, for the three different groups, if you like, we'll take them one by one. How much do you see the conflict having affected mental health in its broadest sense in Jerusalem, where you are, and across the country? From let's take them as the patients, those who've been professionally involved in the conflict, and the medical staff looking after them, because the impact is obviously very huge on all three groups, but not necessarily in the same way or in the same direction.
Right. I think being staff in a Jerusalem hospital, we are very well experienced in working within the conflict. We live in Jerusalem. We have ultra-Orthodox, secular Jews, Muslim, Christians, all are regular patients at the hospital, and we are quite experienced in the delicate interactions that we have with patients and staff in the conflict. And of course, since October 7th, everything got so elevated in the terms of conflict. But on the other side, the tragedy was so huge that you could not let the conflict be in front. So on the one hand, we saw Arab doctors treating soldiers arriving from Gaza, being casualties of the war, and doing it with such great dedication. And on the other hand, we could see patients that wouldn't agree to be treated by somebody who's not from their own religion or culture. And we also saw within the staff, the conflict arose, and you saw a demand from Arab staff to regret Hamas actions. And we saw a demand from Arab staff, a demand of Arab staff from Jewish staff to show solidarity with what they are dealing with. So we had a very delicate and difficult times within the very first few weeks when everything was so fresh and new, and we didn't know how to deal with all this chaotic situation. But I think it brought new opportunities of discussions and of interactions. And from the very first weeks, we had groups of staff guided by psychologists within the hospital discussing what the conflict brought and discussing all these delicate interactions and what they are bringing to us and how can we solve them, and reminding us what is the major goal that we have is taking care of all the patients that are brought here. And we could also distinguish the different patterns of dealing with the conflict. For example, we saw that PTSD was even more present within the Arab Israeli population than within the Jewish population, which is something that maybe is not intuitive, but this is what the data showed.
Mm-hmm. If we can roll back before this period, go back to the period of October the 7th, 2023. Give us an idea of, when people talk about the psychological impact on the state of Israel and the people in Israel, and the fact that it reflects deeper and darker historical trends. How would you, as a psychologist, before we come on to the aftermath of all of this, how would you describe to us what the impact of the Hamas attacks were on the psyche of the people in Israel?
Well, I think the most common reaction and what people are always asking about is PTSD, post-traumatic stress disorder. How many people in Israel are suffering PTSD? And know that there is a trend of saying it's a nation in trauma. Everyone has PTSD. So maybe I would first relate to that and say that all the citizens of Israel have gone through trauma. There is no other way of describing that. There was no one person in Israel who wasn't under attack or personally knows somebody who got injured or evacuated or killed in the war. So definitely it is a nation that have undergone trauma. But not everyone who undergoes trauma suffers post-traumatic stress disorder or other disorders. Actually, what we know from data, from our history, and also from what we see in the past 2 years, most of the people who undergo trauma do not suffer psychiatric disorders. they suffer a lot of implication. There are maybe malfunctioning at work or in their families, in their parenting functioning or marital functioning. Sometimes they have sleeping disorders, sometimes their mood changes, but it is proportionally small percentage of people who will suffer major PTSD or major depression or anxiety disorder. So we have a huge variety of reactions that we have to deal with, and PTSD is like the tip of the iceberg, but what we see is a variety of reactions. We see a lot of loss and grief, which is, from my point of view, our major challenge right now. People have lost so many things. People have lost relatives and friends, family. People got injured and lost, limbs. They lost functions. Many people lost their homes. Many people lost their faith. So I think loss and grief, from my point of view, is our major challenge right now.
I mean, I think that this idea that it is a spectrum, and that some people in the same situation as others will have much less of a reaction to it, and other people in the same situation will have a deeply damaging impact on their normal operations. Is there any way that you can identify which people are likely to be more affected by the same trauma as others, or is it purely on a case-by-case basis? What I'm saying is that are there predictive factors that you can identify?
Yeah, actually, there are quite many, and we are very much engaged in the research of the risk and protective factors because, dealing with a population of 10 million people, if we know who are at higher risk, we can approach them, faster. So we're very much interested in understanding who is at higher risk of developing psychological distress following trauma. We actually had the same research conducted in the UK Jewish population a few months ago, also to identify risk and protective factors developing PTSD after being exposed to the war events. So we know that history of psychiatric disorders is a risk factor. Having a mental illness in your family, challenging events beforehand that you felt you didn't cope well beforehand is a risk factor for future traumatic events. Being female is a risk factor. More women are suffering distress than men following traumatic events. Being at a younger age is a risk factor. Feeling helpless in general life is a risk factor because suffering a traumatic event depends a lot on the way you cope with it and the way you understand you're coping with it. And if you feel that your coping is adaptive, if you feel that you are able to cope, you have enough resources, you can actually deal with this challenge and even grow from it, what we call post-traumatic growth. And one of our major goals in therapy, when we work with people who undergone trauma, is to reframe the story, the narrative that they're telling to themselves about what happened during the traumatic event. For example, if I think about the child that was holding the shelter's door for 48 hours when the terrorists are outside in the kibbutz, and felt completely helpless because he was just, lying there holding the door, couldn't do anything to defend himself. And during therapy, when he tells his story, and as a therapist, we can say how brave and smart you were that you knew you should hold the shelter's door. You saved yourself. This is exactly what he did, but instead of feeling helpless, he feels that he was able to protect himself.
Yeah, it's an empowerment
Exactly.
thing. I'm interested in this age issue because there is a sort of an oversimplified narrative, which you'll be well aware of, that people who are older and who've got more memory of the Holocaust or more have still got first-degree relatives who were involved, that they would be more traumatized. And yet you mentioned, obviously, the very young. Is it a bell curve? Is it people at the opposite, at the far ends of the age range being most affected, with people in some kind of midpoint being more resilient, or is that simplifying it too much?
Actually, not really. No, the older people are, the more resilient they are. Of course, in a very general sense, statistically speaking, of course, it is very individual. But statistically, we see that the older people are, the more resilient they are, and we understand it in terms of the challenges they went through in life. As older you get, you had more challenges. You lost people in life. You had medical difficulties. Yes, we do see that Holocaust reminders are a challenge in these 2 years, in people who are Holocaust survivors and even second generation. These reminders play a major role in their coping, in their memories, not necessarily regarding more mental distress, but in the way they cope and understand the situation, in the amount of threat that they feel to their own sense of security, to Israel's security. But we do see that younger age, specifically very small children, they highly rely on their parents' reaction. They don't have the resources to understand the complex reality. They don't have enough experience to rely on, that they know how to deal with such situations, so they are more at risk.
And what does experience suggest the prognosis would be for those youngsters? It will, in time, with the appropriate therapy, are they just going to just adjust normally, or is this going to be a long-term risk?
Depends. Most youngsters will not remain with a psychiatric disorder, but definitely the scars will always be there. And we see children who grew at the Gaza envelope for many years. They suffered many, trials of wars and events with Hamas. They act differently. They were more prone to develop psychological distress now at the Swords of Iron War. So it leaves scars, and the scars are not necessarily manifest in psychological symptoms. Sometimes they manifest in your ability to be part of an intimate relationship, for example, to trust another person, to be a calm and relaxed parent to your children. In many ways it can be manifested.
Let's go roll it forward to how you had to deal with this in the hospital. When I was there, I was amazed at the fact you had the medical staff. There was no ability to differentiate them, from the outside. So you had Jewish doctors treating Arab patients and Arab doctors treating Jewish patients, even patients who were who had been affected on both sides by the conflict in the same wards as professionals from the IDF or elsewhere. Talk us from the outside. This is almost unbelievable. And had I not seen it myself, I'm not sure I would have believed that it was possible to do it so effectively. How do you go about creating the conditions where patients see themselves as patients and not continuing as being on one side or the other of the conflict? How do you go about organizing a hospital wards, hospital bays, where this can happen? Because I found it extraordinary that I could see it with my own eyes, that it was being organized in that way.
Well, I think you cannot invent such a culture, such an environment when the war begins. If you don't put the roots, many years in advance, and creating the environment that enables that in times of peace, it will not work in times of war.
Okay.
But we have been working like that. I've been working at Hadassah for 22 years. That's how I know the place. We grew up together, me and my colleagues, psychologists and physicians and occupational therapists, physiotherapists. Jews, Muslims, Christians, Druze, ultra-Orthodox, seculars, we grew up together. And whenever there was a conflict, we would work through it. We would have workshops. There is no way that a medical staff would refuse treating nobody. I'm not speaking about an Arab Israeli or a Palestinian from Gaza, which we had, thousands throughout the years. Children from Gaza are treated for pediatric cancer at Hadassah's departments since always. They arrive to our hemato-oncology department, and because of security reasons, they cannot roam around in Israel. They just live in our department, sometimes for 6 months, for a year. The whole family lives in our department so that the child would receive his chemotherapy until he recovers. Sometimes we have terrorists treated at Hadassah. They are being caught and they got injured during the attack, and they are being taken care of in our own departments. So this is an environment that is like, there is no other way for us. So when the war began, it was still the same environment. It's still the same place, same colleagues.
And important for people watching us to explain that, contrary to what people might think, that there is no discrimination, there is no segregation of patients coming into Hadassah. It's purely on the basis of clinical need. So, as you say, people from all backgrounds, from all religious, from all national, from all social backgrounds will come into the hospital, will come into the A&E, and they will be sifted there, triaged, and treated purely on the basis of their clinical need. I'm not sure that everybody that's going to be watching this will understand that that is the case.
I can't even imagine when you say that such a discrimination would occur.
Yeah, well, of course, and as a doctor, the ethical implications of that are so horrible. You can't really go down that route. But so when we've got the patients coming in, obviously, and as you say, you've got all sorts of people together. You've got potential terrorists, you've got members of the armed forces, you've got the police, you've got all sorts of people who are victims, not just what we might call civilian victims, but you've got a whole range of people who are coming in as patients. And it's one thing you're getting them the treatment. One of the things that really amazed me was that even sitting at dinner, as we did with some of the doctors there, the doctors themselves were very clearly immune to taking personal views on the conflict, which is, of course, part of the ethical training, and you would expect doctors to do that, but not easy for medical professionals to entirely separate themselves into their professional lives and their personal lives, which have political views and have family traumas and have family experiences. When you're working with the medical staff, and by that I mean all the different medical staff, doctors, nurses, physios, all the people who will have patient contact, how do you go about getting their mindset supported and adjusted to that environment? Because as I know from experience, it's quite hard to entirely leave behind your own views, even although that's what you're trained to do. So in a situation of trauma, the likes of which you've described, how do you help those medical professionals ensure that they're not building themselves up PTSD for the future?
Yeah, you describe what we call secondary
Yeah.
traumatization. So what happened when a person is exposed to somebody else's traumas, so frequently, and I think what made it more difficult these past 2 years is that everyone was affected. So I think, in our daily lives, once we had ones, you could treat somebody that their view or culture or religion was very different from yours, but you were able, to put this costume, this professional costume on yourself, and not to see the person's beliefs and behavior and culture, just to see him as a patient and give your best, professional treatment. But since the war began, it is so personal, because everyone knows somebody, and you meet someone and it reminds you a very, very close and recent experience. So your ability to put like a screen between you and the patient and only act professionally became much more difficult. And as psychologists, we put ourselves as the guards to notice the staff that are taking it a bit too hard, that it is a bit too much for them, and offer our help. So we provided, and we still do provide a one-on-one therapy. It can even be one session, just for ventilation, to have somewhere else to bring your experience and emotions there, and then you go back, more recovered to your work. And we had groups of staff that we could, talk like in group therapy, working on that to see who's had too much.
So do you have a service for the doctors to give them the pointers that they should be looking for in being able to self-identify when they're becoming stressed, or is it up to them to reach a certain point and self-refer to you, or are they referred by others, or is it a bit of all of these?
A bit of all of these. So we have workshops that we provide to the medical staff so that they can have their own tools to identify themselves and to identify among their colleagues, and then they can act upon themselves or refer to further help. And we also have like a shorter waiting list for the medical staff if they seek for therapy on their own initiative.
I mean, I remember in visiting one of the wards and raising this subject with the doctor and saying to him, how do you park all your personal prejudices and beliefs, which everybody has, during such a time of crisis and such a high volume of patients coming in? And his answer has stuck with me ever since. And his answer was, everybody bleeds red, was his answer. And it was such a human thing to say, and yet such a wonderful thing to say. It has kept with me. Can you tell us, I mean, with all of this, can you give us a human story? Give us an example of where your work with the patients or communities has provided them with outstanding resilience or an ability to deal with trauma in a way that they wouldn't otherwise have done. And I'm asking really to give us an example of where clinical psychology in all of this can be a lifeline, and where it has, in your experience, already worked.
Well, I have like hundreds of stories, but maybe I will tell you about a reserve soldier that I saw from the very beginning of the war. He got injured maybe a month after the war began. He was fighting in Gaza. He was married, had 3 little boys, and he got injured. He got shot by a sniper, and he got injured in his leg. And his injury was not so severe, but his mental reaction was very extreme. And I was called to the hospital on Saturday, on Shabbat, which is quite rare, because his stress reaction was so severe that he wouldn't let the physicians approach him and provide him treatment. And our goal is to provide medication the less possible in this situation. So I arrived and I used techniques of calming down and relaxation so that I will be able to speak with him, and it was quite efficient. So I provided him with tools of self-relaxation so he could also use them when I'm away. And he began to tell me the way he got injured. And I saw that the story that he's telling is so confused. Like there was no coherence in his story. And this is one of the risk factors for developing PTSD, that the story is very badly organized. And this is why later on we have flashbacks and nightmares and intruding memories, because the memory is not organized in a way that normal memories are, like restored in the brain. So I suggested that we start working on his injury narrative, which is not something that we often do right after the injury. Sometimes we give, the acute treatment, the first priority. But I thought that that was the best thing that I could offer at the time. So I saw him on a daily basis, and we started working on the narrative of his injury. But very soon we understood that the traumatic event was not when he got injured. The traumatic event happened on October 8th, when he just began his military service, and they were still not inside Gaza. They were at Gaza envelope at the kibbutzim, and he collected bodies. He collected bodies of people who were very, very brutally murdered. Some of them were brutally sexually abused. And he saw all that. But later on, he got into Gaza, he got fighting, got injured. Everybody thought that the traumatic event was being injured. But when we started working on this narrative, I understood that was not a thing. I saw that the story did not raise the emotion that I expected. And when we went back, we understood what the real traumatic event was, the very first days of the war. So we worked mainly on that. And his story became more and more coherent. And as that happened, his symptoms got better, and he slept better, and he had less memories intruding. And when he was able to being discharged from the acute ward, from the orthopedic ward, and moving to rehabilitation, I moved with him to rehabilitation. When he was ready to meet his children, we had a major work done on how to tell his children the story of his injury in a way that they could also absorb that, and how to deal with the children. He still had anger bursts, so how to deal with the children if he becomes irritated, and how to go back home when he was discharged and go back to his normal life, which was quite difficult for him. He was still having depressive symptoms, so how to go back to his occupational work. And the whole therapy was about 6 months. I saw him a bit after he got discharged. He also continued coming to his psychotherapy sessions for a while. And then we ended the therapy because he was in a much better shape. And a few weeks ago, I got a message from him texting me and sending me a picture that he just went back to his military reserve and completed officer's course. And I think that that was really moving, because it was a sign of resilience. That not only he was able to go back to his civilian lives, but he also felt that he was able to go back to his military service and become an officer, and kind of completing the mission that he began.
What I find very interesting from my own background is that the mental health issues are treated simultaneously with the physical issues. It's not a question of let's get you better, then deal with the mental health components. It is very, very much integrated into the thinking of how to make the whole patient better in a more holistic way. And you've got quite a big team of psychologists. I think that, when we're talking about, 130 across your different campuses is a big resource for you to have. Is that something that's been born of the experiences in Israel, or is this something that's just culturally part of the medical thinking there? Because it certainly wouldn't be part of the thinking across much of the Anglo-Saxon world.
Yeah, I know it's quite unique. It's also quite unique in Israel. It's one of the biggest psychology departments in Israel as well. Um, but yes, I think at Hadassah it is very clear that the mental aspects of dealing with the physical disability or physical illness is an inseparable part of coping. And we see sometimes that very small medical issues raise huge mental difficulties and dysfunctioning, and vice versa as well. So in almost every department and clinic within the general hospital, there are psychologists that are expertised with working with this specific medical condition, whether it be oncology or pediatric rehabilitation, cardiology, gastro, and so on. So people are specialized in treating the mental aspects of having a specific medical situation, and we see very good results, in people, having less procedures, less acute turns into the hospital, less hospitalization stays.
Yes, I mean it is an object lesson, I think, in seeing the patient holistically, and seeing the physical and the psychological and mental health issues all as one. Looking at this from a slightly different perspective, and maybe just wanting to take a more optimistic view, we tend to see the, and even I've been talking to you about the patients as almost as though they're combatants on different sides. Is there any way in which the common experience of injury and healing and being treated together, is there any way in which you think that that might act as a bridge in some way in the future, where people can, if you like, recognize their humanity as being of great importance, rather than seeing one another as representatives of different ethnic or national or religious groups? Is there anything we can take, hopefully, out of how patients react, and how they react to one another afterwards? Do people build relationships? Do they make friendships across these divides?
Wow, it's a tough question, because I think trauma brings people together, but also highlights the differences. So when facing threat, people tend to gather in their in-groups and to highlight the differences between their in-group and their out-group. But I think at the aftermath, maybe nowadays, this is the time when we can raise above that tendency and praise the resilience that we see among our people, and understand that if people can grow out of such traumatic events, then human beings are much more resilient than we usually think they are, and to build on this resilience in order to improve our relationships and to improve our coping, and to believe that we are able to do better.
And how much, going back to the Hadassah as an institution, how much does the common experience of that have as a future potential to not just improve resilience in terms of mental health, but potentially to be a tool that we might use to improve social cohesion going forward?
Mhm. I think we have a role in doing that. Now, Hadassah has relationships in communities around the world, and we have actually this research that I told you earlier that we conducted within the Jewish community at the UK, and we found there that social support within the community was a major risk and protective factor against developing psychopathology. And we are also conducting the same research in Australia now. And I think this is a message that we can bring to the world regarding the way that social ties and interactions are a very important protective factor when people are facing not just, mass casualty events like
Yeah.
October 7th, but facing challenges within their lives.
I was thinking sort of the fact that, afterwards, the one thing that everyone will have in common is that they were patients of Hadassah. They were, they were treated in a culture that regarded them all as being the same, as being human beings, irrespective of nationality, ethnicity, religion, and so on. Is there something to build there? Is there something for Hadassah to build in as an institution, in having a role in taking some of at least these little positive nuggets going forward?
I think it's a great idea.
Well, hopefully, maybe somebody who's watching will be able to pick up on it. And I really have to ask, you know, you're psychologists, you're all human too. Who looks after you?
Thank you for asking. We're trying to take a good look of ourselves. We have supervision groups. Each and every psychologist at the hospital is part of a supervision relationship of a supervisor and a supervisee. So we all have a place where we can also, share our experiences and feelings. And I am trying to keep a close eye on my workers and to see my staff and to see whoever is in greater difficulty and to maybe allocate them to different missions or give them sometimes other tasks to do just to have less burden on themselves. We had more than 40 psychologists at our staff were on reserve duty during these past 2 years. They have suffered, very difficult experiences as warriors and also as mental health providers within the IDF. We had many psychologists whose husbands and children were on reserve duty at the IDFs. We had a lot of challenges, not only in working, but also in our personal lives as well.
Now, the main reason that I wanted us to have this conversation again was the conversation we had when we met over dinner, which was the old nugget of forgive and forget, and how people going forward, once they're past the initial trauma period, how do you get people to park their anger and resentment and all the negative feelings and try to foster this concept of forgiveness and forgetting? It was your answer to that question when I first met you that totally fascinated me, and I'm sure would, in the last 5 minutes, just blow the minds of the people who are watching this today.
Well, I don't remember what I said, but I would answer your question now. I'm not such a great believer in forgetting. I think what we went through is part of our lives, and I wouldn't want to forget anything that I went through, and I
Uh-huh.
wouldn't ask one of my patients to forget what they went through. But I believe that what we're going through is part of who we are, and the way to forgive is to integrate all the experience that we went through, including the traumatic ones and the very bad ones, into the person that we've become, and to
Yeah.
see how we grow out of these experiences being better persons, using the resources that we had in coping with these events to feel more enabled. And when you feel that you have the strength and the resources to deal with such traumatic events, you also have the strength to forgive. And not only to forgive others for what they've done to you or to others, but also to forgive yourself for maybe not coping in the best way you wanted or not being the exact person you wanted to be, because blame is a major emotion that we're dealing with, and
Hmm.
forgive ourselves for things that have happened and didn't happen is one of the best gifts that therapy can do to people.
to paraphrase what you were saying at dinner, was that not forgetting is about how we learn from mistakes, and it's key to what we do in the future. Forgiveness is a way of dealing with the emotional issues, and is key to what we will be as people in the future. And I think, for me, it's such a great and positive differentiation that we have to learn, and rather than forget that these things happen, it's to understand why they happened and how we can avoid them happening again. But forgiveness is very much giving ourselves permission to move on, and to be able to, I suppose, be better people. But I think it's such a great thing to think about, and we use the phrase, forgive and forget, as though the two things are the same, without really disaggregating them in a way that can actually help us going forward. So, listen, I'm so grateful to you for your time. It's amazing how quickly the time goes in these conversations. Usually, I could sit for another hour easily and raise all sorts of issues. But I'm so grateful to you for coming to talk with us today. I think it's been a wonderful insight into the work that you do, and on behalf of so many people who may never get the opportunity in a public forum, just to say thank you so much for all the work that you do, for all the work that your colleagues do, many of whom I met, and for what Hadassah does as an institution. I think it's remarkable. And I think it's a great lesson to the world outside that even in the midst of the darkest and the deepest trauma, that it is still possible to see one another as human beings, and to behave accordingly. And maybe even in the dreadful situation that it's been, you're able to shine a light of optimism and hope in some way, and that maybe with in the right conditions, we can just learn from what you've done. So thank you so much. It's been inspiring, to say the least, to get to see you again. And I wish you and all your colleagues well in what will be the continuing work for a long time, for lifetimes.
Thank you so much, Liam. It was my pleasure, and it's an honor to be here. Thank you so much for
It
inviting
was
me.
great. And I look forward to dinner next time.
Me too.
Thank you very much.
Thank
Bye-bye.
you. Bye-bye.